So equipment wise, you don't need much. If you have bad knees, a rolled up towel or a foam pad like this is going to be helpful. A pair of yoga blocks is there for modifications, which I'm going to show, but it's definitely not absolutely necessary. I'm going to do everything 10 to 15 repetitions, but you can modify. I especially in the morning when my body is stiff, I don't do longer holds. Maybe later towards the practice, I do a little longer holds, but at the beginning, I try to stay away from long holds of 5 to 10 seconds. Depending on the movement that I do, I either hold for a few seconds or I just hold, like I said, 5 to 10 seconds tops. But it's up to you. If you feel like some poses are difficult, some movements are difficult, then you can just be there short. And if some movements feels good, and if you want to be there longer, as long as it's not creating pain, you can just be there for a short period. For a long period. So without any wasting time, let's start. First movement is going to be cat-cow. This is especially useful in the morning just to wake up our back, just to get breathing done. So what we are going to do when we are in this position right here, I want you to breathe in. And when we are in the other position where we are curled up, I want you to breathe out. Breathing out actually kind of gives you a little bit more range of motion. I like to do it about 10 times. So this is how it's going to look. And after that, I like to go straight into child's pose, followed by a back extension. So just go deep in, relax, breathe in and out. Be here for a few seconds at the beginning. And then, once I kind of get it a little settled, it kind of alternates. So I go a little back extension, and then back to child's pose. And then alternate your breath. So breathe in. What I like to do, especially in the morning, because I'm stiff, I don't go all the way in extension. And as the repetition progresses, I go a little deeper. If you are having pinching sensations and stuff like that, you are in charge, modify, just only go to the point where it doesn't hurt. There shouldn't be any acute sensation, any pinching sensation. Also, as you go deeper, it's helpful if you squeeze your butt, and that allows for back to pinch a little bit less if there is any pinching. And if you want, you can be in this position right here for a little bit. While I'm here, I like to move. I'm getting a little lat stretch in this position. And then to the other side, breathe out. Breathe in as you move. Again, as I start getting looser, I may either hold on to that position a little longer, or I may just go to a deeper stretch. Again, don't overdo it. Okay, now from this position, this is where if you have knee pain or if it feels uncomfortable, you're going to put one knee on the foam pad or rolled up towel, and then we're going to go in this position right here. And what you're going to do is you're going to posteriorly tilt your pelvis. So anteriorly pelvis tilting is going to create arch in your back. Posterior tilt is going to decrease that arch. So you're going to do a little posterior tilt, squeeze the butt where the knee is kind of on the floor, and you're just going to rock forward and back 10 times. 2. The most important thing is to keep squeezing that glutes at all times. 3, 4. Again, if you're stiff, you don't want to overdo this. 4, the range. 5, 6, 7, 8, 9, 10. And then switch. Same thing. 1, 2, 3, 4. Keep that squeeze, posterior tilt. We don't want any arch, okay? 5, 6, 7, 8, 9, 10. Good. Now we're going to switch again. You're going to be in this same position, but this time you are going to rotate and you're going to work on the upper back. So squeeze the butt, suck your stomach in. Same thing, posterior pelvic tilt, put your hand together, and you're going to turn 1, 10 times each side. 1, 2, 2, 3, 3. Move your neck. Helps to open up your chest, open up your upper back. 4, 5, 5, 6, 6, 7. Only go to the point where it doesn't hurt. 7, 8, 8, 9, 9, 10, 10. Good. If you're feeling tired, always feel free to go in a child's pose and then rest for a few minutes or a few seconds, whatever feels comfortable. If you want to go deeper on the child's pose, just spread your legs, spread your knees, and that way you can go a little deeper and just relax. Okay, if we are ready, we can do the other side. I'm going to keep that guy here. Okay, now the other side. 1, 1, 2, 2, 3, 3. Suck your stomach in. Squeeze the squat. 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, 10. Okay. Again, if you need to, rest the needle. Feel free to take a few seconds break and child's pose. Or if that's uncomfortable, just be in this position. This is good as well. Okay, next one, you're going to put whichever leg forward. And this time, back knee is going straight. We'll do the world's greatest stretch. So the side, where the knee is up, the hand is go loop under the other arm, and then open 5 times. 1. Try to keep the back leg straight, best of your ability. 2. If there is a little bend, it's okay. Don't beat yourself. 3, 4, 5. Very good. If needed, take a little break. If not, continue on the other side. Back leg straight. 1. Really good for hip mobility, upper back mobility. 2, 3, 4, 5. Okay. Take a little break if you need to. And after you're done with that, we'll go to the downward dog. But we'll do an elephant leg first, alternating. Try to push. Just try to do your best. This one really, just active pedaling, stretches your hamstrings. And just the fact that you're really actively pushing through your hand works on your shoulder mobility as well as your upper back mobility. And then once you feel you're loose enough, go ahead and go on to the downward dog. Okay, let's be here for 5 seconds. And then we're going to switch to pigeon. 5-second holds. 1, 2, 3, 4, 5. Then go back. Downward dog. 5 seconds. 1, 2, 3, 4, 5. If doing the downward dog like that is hard, you can do it on the yoga blocks. It will make it a little bit easier, as you can see. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. A second. We'll do a total of 5 reps. Two, 3, 4, 5. Feel free to hold the pose a little longer if you need to. 4, 5, 4. 4, 5. 1, 2, 3, 4, 5. Last rep. And from this position, while I'm already here, I go into the hip 90-90. So you're just going to turn your legs 90-90 like this, and then switch. One thing you will realize is after all this, your hips are quite open. Try to maintain an upright posture. Again, you are in charge of how much you push yourself. If there is any acute sensation, pain, you modify, which is basically you can lean back, and that makes the exercise a lot easier. 4, 5, 5, 6, 6, 7, and it's normal if your butt scoots every way. 8, 9, 9, 10, 10. Very good. Again, if you want, you can go to the child's pose. If not, we're going to stretch our groin while we are in this position with the butterfly stretch. Try to put your feet close together like this. Okay? If you can, if you are maintaining a good spinal position, straight spinal position, then you can bend as much as you can. I can't, I'm still working on it. So I'm just going to be here. The other great way to do it, you're going to put your hand inside like this, and you're going to put it up. Have a good posture. Try your best. If you try the best to not run like this, right? So be in this position and hold. This one I like to hold for a little bit. Alright. Again, I'm not looking at the clock or anything. And then you can kind of move a little, whatever direction. And then let's go back to that pose again. And now, the last one, you're going to put your right leg over your left thigh. You're going to use your left arm to hug the right knee and try to maintain a good posture, and then twist. If going all the way here, like this, creates any kind of sensation, feel free to just do this. And eventually, kind of go here. And hold. And same thing. Hold. 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 Five. 5. Another one. Last one. And you know, if you do one less or one more, it's okay, it's not the end of the world. Just do what feels right to your body. Good. We're kind of coming towards the end here. Almost. So, the last one again, if you want, always feel free to go into child's pose. Take a few deep breaths. Remember, if you inch your arm forward, you'll also stretch your lats, work on your shoulder mobility. Spread your legs so that you can go a little deeper. And then, we're almost coming up to the end here. squat down. If you have a hard time squatting down like this, then if you can't, we're going to go somewhere and hold on to something sturdy so that you don't feel like you're going to tip back while maintaining a good posture. And then you're going to, if not, then you can just come back, squat normal, chest high, and you're going to lean to one side. And this is going to work your ankle mobility. Make sure that the ankle as you lean doesn't come off the floor, okay? The knee should be in line with the second toe. Hold for 5. We're going to do a 10 repetition. 3, 4, 5, 6, 7, 8, 9, 10. So that was a 20-minute full body mobility workout that I do anytime when I'm feeling stiff. I like to do this at least twice a week, trying to work on my mobility more. Hopefully you liked this video. If you did, please make sure you click the like button. Please subscribe to my channel because more videos on physical therapy coming soon. Until then, take care. Bye-bye.